Hi, welcome to the podcast, Aging Gracefully with Julie Roca. I'm very excited to be back in the studio. This is the third year in a row that we are recording these podcasts and sharing them with you. And today, I can't wait to have this discussion. We've been talking about it since I started recording the podcast. I have my precious friend Elizabeth Halloran here, and the conversation comes up frequently about pets. And we all know pets are such a treasure for so many people. And so I want to talk today about the treasure that they are and about a more difficult subject, I guess, when it's not right for some of our people to have pets. So I've brought Elizabeth Halloran here today. Thank you for coming, Elizabeth.
Thank you for having me, Julie. I appreciate it.
Yeah, we've been very excited. Both you and I
been looking forward to this.
Have our much loved pets, children, pets. And you have something in common with me. You have years and years of healthcare training. In fact, way more than me. How many years of healthcare background do you have?
Well over 30 years.
Well over 30 years. So you may not know this, but back when I was a young lass coming into the healthcare scene, it was actually you and probably just a couple other very key people that helped me to figure out the ropes and helped me to learn how to network and incorporate myself into different networking scenarios that I needed to be in. So I've always been super grateful for that and your expertise. But now you're in kind of a new adventure.
I am.
Tell me about that.
Well, a new adventure as far as professionally or career-wise goes, yes. I grew up saving animals, from possums to birds to dogs to cats to whatever I could find. So I grew up saving animals, and it's been a love of mine, a passion of mine. And then, of course, as I got older, getting into healthcare was a true passion. So for me, this is the beauty every day that I get to wake up to, is that I get to work in both of my passions that I absolutely love.
And this passion that you jumped into came with a special little package. So tell me about how, because this was quite the jump for us to watch you make.
Yes, it was.
Tell me about what happened that helped you to make that.
So I had lost my baby of 19 years, my little fur baby of 19 years, and was terribly lonely. Working from home, I felt like I could still hear her, see her at times, and it was very lonely. But I received a phone call from the Lake City Humane Society and said, we have a little 8-week-old Chihuahua that needs a home. And I said, well, send me a picture. I'm not sure I'm ready yet, but send me a picture. And she did, and it was this darling little baby. And so I happened to be in Lake City for a North Florida Healthcare Association meeting.
Yes.
And she texted me, so are you going to stop by today and see the baby? And so I thought, well, I'm in Lake City. I'm right here. Yeah, why not? So I did. I walked in, fell in love with her. Did not take her home with me immediately because I had to talk to Paul about it and tell him my plan.
Make him feel like
exactly, make him feel like his opinion mattered. And so sitting on the sofa that night talking about it and everything, I named her, and her name was Gracie Bell.
So cute.
And so that kind of sealed the deal that I knew that the next day I was going to go get her.
And to be honest, husband Paul loved her
right away.
So,
Immediately.
yes.
Immediately. So Gracie Bell, when I walked in to adopt Gracie Bell, I was asked to take over the position as the executive director for the Lake City Humane Society. And I thought, it's not healthcare, but it's still that passion of saving lives and helping people and finding placement. And so I thought about it, and I thought, you know what, why not? I could make some changes that need to be made and get these animals into loving homes.
Yes.
And so Gracie Bell saved my life, and I saved hers. And today, by the way, is Make Your Life Better Day.
Oh, Oh, I did not know that.
Make a dog's life better.
Make a dog's life better.
Yeah, make a dog's life better.
We're actually recording before this will be released. So today is actually, what is it? January 23rd or 24th?
I think it's 24th.
Yeah. So this will come out in several weeks down the road. But I wanted to talk a lot about how we kind of marry this life together. Yep. Your expertise in senior living and helping seniors to age,
Absolutely.
And now this passion for the pets. I have seen some of the great advantages of having pets in a life, and I know that you have too. What are some of those that you see are advantages, true advantages to having pets?
The companionship.
Yep.
The companionship alone is a great advantage to having a pet. And, when I was going into clients' homes, patients' homes, I was seeing this. They had pets. So I saw not so much the advantage to it, but I also saw the heartbreak of it as well.
Right.
Because maybe they were going to be leaving their home and going into a community, a facility, a retirement facility, and they could not take their beloved pet with them.
Right.
So, of course, that brought, a lot of sadness and extra stress. But the companionship of having someone, not being alone, means so much.
Oh, yeah. There have been so many studies on the bad side effects of isolation, and even a pet can help with those feelings of isolation to not feel that as much.
Certainly.
So,
and even for me, like I said, when I lost my little Murphy, I was working from home, so it was very kind of isolated.
Yes.
And I missed that companionship of her being there in the home with me.
Yeah.
So I could only imagine for someone older than me going through the same thing and with dealing with a loss.
Yeah. I got to tell you a little inside glimpse of me. My husband is out of town regularly with his job, and I talk to my dogs like they are people in the room. Now, they do not answer back. They're very sweet and very kind and pretend to listen.
And they can keep a secret.
And my German Shepherd, man, you talk to him and ask him a question and his little head tilts, man, they just rock my world.
Yes, most definitely. Most definitely. And I'll tell you, Gracie came in and she rocked our world, and so lovingly. And I'll say that I have 3 more since then that I've rescued.
I know.
So
you got a house full of pups.
I do.
One of the other things that I think I've seen, especially in seniors, is that pets give a sense of purpose.
They do.
And, when somebody needs to be there for another being to feed them, or make sure that they get the love that they need,
Most
or,
definitely.
Give them little snacks and treats. I mean, the sense of purpose that brings is wonderful.
It does. It's a twofold. It gives the advantage of the companionship and a purpose for getting up in the morning.
Yes, exactly. I mean, you think about it, even if you've got a dog that needs to be walked, it's purpose to get up and move, which is so helpful as we age. If you don't lose it, you lose. If you don't use it, you lose it. And that comes with movement as well.
Most
so
definitely.
A pet that makes you move is a good thing. So we know all the great things, but I'm going to share a story. And this is something that a lot of people don't want to discuss because they say, oh, pets are great. Pets are great. My loved one needs their pet. Got to find a way to make them have it. But I was working in an assisted living, and there was a lady who had the most darling little dogs. And we had noticed that they had been packing on the pounds, and she would regularly say, I need to feed my dogs. I need to feed my dogs. And there was some cognition issues going on, right? We could all tell. And so the family had a conference, and we decided that she was probably not capable of knowing when exactly to feed the dogs. And so the food was removed, and the CNAs were stepping in, and they were starting to feed the dog. And one day I noticed the dog came spilling out of the room, vomiting blood all over. And I mean, just absolutely terrifying and awful. And what had happened is she had gotten so far in her loss of cognition that anything she saw that looked like it could be a treat or food, she was consistently feeding the dog. So her medication that she had, chocolates that were on her counter that her loving family had brought her, anything. And it was literally killing the pet. So I want to talk about that with you today, because there is a time.
There is.
When we throw in the towel and say, this isn't the best idea.
And those are the very difficult times.
Those are so difficult. And have you ever had to have that discussion with a family member to say, hey, might not be best to have this pet?
Absolutely. Comes with that a great fall risk.
Yes, the fall risk.
Right, is tremendous.
Yeah.
If the dog gets out, we can no longer chase it down and catch the dog.
Right.
Then the dog becomes a stray. So there are so many reasons that need to be well thought out, I guess.
Yeah.
When that time comes, we get calls quite frequently, probably every day, at least 2 to 3 calls every day for elderly that have either lost the dog because they couldn't catch the dog and it got away from them, or they've fallen.
Wow. And I hadn't even thought about when they reach a point where they can get away from you and you no longer can go after them.
Right.
Hadn't even thought about that one. But also, you and I were talking about a scenario the other day where a lady is frequently needing to go to the hospital and then may need to go for a week or longer in a skilled nursing facility. And the pet is left behind.
Left behind, no food, no water, no way to feed themselves. Thankfully, there's neighbors or something that stops in to check or whatever, and those are usually the phone calls we get, then that those animals have to be picked up and brought in because there's no one there to take care of them, and they have no idea when this person's going to be returning home or even able to.
Right. And so I think, and correct me if I'm wrong, I feel like it's better if family or close friends can sit down and have the discussion before it gets to that point.
Right.
Because once it gets to that point, do you feel like they struggle with understanding what has happened?
Absolutely. Absolutely. Because to them, that's their baby.
Yes.
That's all they know. They probably see them more than they do the family. They see the pets more than they do the family. Sometimes, sadly enough, Julie, as you and I both know, that sometimes the family emerges an emergency situation.
Right. Yeah.
And other than that, family's not always there. But that pet is always there day in, day out. That dog, that cat is always there.
Yeah.
So that is very heartbreaking then when they have to come to terms with that. And it makes it very, very difficult.
Yes, it does. I've seen people be so confused, and they wonder what have they done.
They go into deep depression.
That their pet has been removed from them.
Yes.
So when there's family planning, I think there needs to be
included. The pets need to be included in the welfare.
And the station that they're going to have in life, and what happens to the pet if mom or dad needs a higher level of care, or mom and dad are struggling with, balance and gait. Should they be having the pet anymore? Now, all that is very difficult. Very difficult discussion to have. Very difficult to wrap your head around. But you and I have also seen some families that have figured it out, right? So they don't just take the pet and the loved one never sees it again. That is like the worst case scenario. When your company has to step in and remove the pet and then find a home and they have no say in it. And that's the hardest part, right?
That is the hardest part.
But tell me some other scenarios.
Well, sometimes too, a lot of times when this happens, the pet also comes to us in very ill health because they've not been to the vet, because they weren't able to drive and take them to the vet.
That's right.
They couldn't afford the vet bills. So the pet comes to us in very bad health, either not groomed properly, medications not adhered to, like heartworm medication, things of this nature. So all these things kind of go by the wayside. because they just don't think about having to keep up with this part of the pet care.
Right. It's a lot.
So it can make it very, very difficult. We also at times have people come in that's elderly that is on a walker or a wheelchair and they want to adopt. And that does make it difficult too, because coming from the healthcare industry, I have to look at being able to take care of this pet once it's adopted and brought into the home.
Exactly. Yes. And there are going to be limitations. For example, you're probably not going to let someone with a walker adopt a Great Dane.
No.
Or even a German Shepherd, because my Shepherd runs a lot.
Yes.
He's fast and he's got lots of energy. So even looking at that and saying, what kind of a pet is it that you're going to be able to manage in your condition is something I hadn't thought about too.
And so many times we have people come in and they want a puppy. You know, let's face it, you're in your 80s and you want to adopt a puppy. That puppy's going to grow up and it's going to be hard to walk on the leash as it grows up. It's going to chew on things. It's going to be into everything.
Let's not even talk about the fact that it's going to piddle on the floor 10 times a day for the first couple months. You got to get down there and clean that
That's
up.
right. Exactly.
And or take them outside every 20 minutes.
Right.
Yeah.
There's even toys that are choking hazards, you know, just like a baby, that if, you know, you're older, your reflexes are slower and you're not able to get to.
Right. Yeah.
So there's so many things to look out for. So I do take that time to sit down with that person and explain things to them, because I want them to go into this eyes wide open.
Right.
And so then I can help them hopefully to choose more wisely as to what it is they're looking to adopt.
Right. Yeah. Because they might not be able to handle a puppy, but they might be able to handle an older cat.
Right. A senior dog or cat would be fabulous. They're more laid back. They want to lay around and sleep. They want to cuddle. They're much easier to take care of as we get older.
Great thought. Great insight. See, you're learning so many things in your new role. I love this.
I love my new role.
So another thing that I have seen is that family members will, as the time comes and the pet is no longer 100% safe for the person to keep, the family members will take the animals home. I'm thinking of a beautiful gentleman right now. He's got some cognitive issues. He's in a community that I love and I go to regularly, and he had 3 little tiny dogs, and they're a little bit older because all they want to do is sleep. They just want to be around him and be in his lap. So the family members will bring the dogs to his community because they can't have pets living there, but they'll bring these little dogs to his community and they will drop them off for an hour or 2 and then come back and pick them up. So he's not responsible for feeding them. He's not responsible for walking them. Nobody in the community is, because they don't have time for that. And he's not a trip hazard for anybody. They're not a trip hazard for anybody else because they're just kind of curled up in his lap every time I go. And they've dropped the dogs off. So that is one way to kind of work around that, is to take control of the pet so that you're there for the care. Now, some places won't let you drop them off, but most places will allow a pet to come in and visit.
We actually have visitation day at the shelter, and so many of our long-term care facilities bring the residents into the shelter to visit with the animals and get to pet them and love on them for a while.
And
so that makes a huge difference.
And you have a new thing that is so fun. Tell me about Pup Cup Tuesday.
Pup Cup Tuesday. That's so much fun. So the community gets to come out and do pup cups with our dogs every Tuesday around 3:30. And that is a delight. Everyone loves Pup Cup Day. So Pup Cup is Ready Whip.
Yeah, basically you squeeze a Ready Whip into a cup.
So they come and see us with Ready Whip in hand and ready to go, and they love it. And the pups are looking forward to it. They know every Tuesday is Pup Cup Day.
And you can actually go on the Facebook page at the Lake City Humane Society, and you can watch the videos. I don't necessarily have the time to drive to Lake City and take part in Pup Cup Day, but I have definitely watched several pups enjoy their Pup Cup.
It's great.
Another way that seniors can actively take part, though, in pet care is to help with some of those supplies that your local Humane Society needs. Tell us some of those needs.
We get so much help from our community, and some of them that are elderly that make donations to the shelter. Not just monetary donations, but also donations of things that we need. Like Christmas, we did Christmas stockings for all the animals for Christmas, and we hung them on the kennels. And our community came through and brought in toys and treats to fill those stockings with. And then our
so cute.
Our kennel techs and our staff got into the kennels with them, opened up the stocking for them, and took out the toys and the treats. And it was just such a fun time. So we get a great support from our community.
That was so cute. And everybody thinks about, okay, you need donations of toys. Maybe they think about donations of blankets. Maybe they don't. We're in Florida, so I think that blankets aren't thought about a lot.
Right.
And pet beds aren't thought about a lot. But we have experienced a very cold winter here. I mean, you and I are both bundled up today. And I'm trying not to shiver right this second, but it has been a cold winter here.
It has.
And I know other places throughout the United States have been experiencing the same.
Right.
So a senior may be in that time where they ought to be cleaning out anyways.
Absolutely.
They may have some blankets, maybe some pillows, some cushions that can be used as pet beds.
And we have had an outpouring of support from our community that sense, bringing in blankets. We use a lot of Dawn dish detergent and a lot of bleach because there's laundry to do. We have to wash those blankets.
I hadn't even thought about that. You mentioned in one of our meetings the other day that you have a constant need for Dawn dish detergent and bleach. And what was something else you said? And I was like, oh, never thought about that.
Yeah.
Oh, food.
Food, always food.
Constant need for food.
The other thing that people don't think about is isolation gowns and the little booties to go over the shoes. Because when we have puppies in the isolation suites, we have to gown up and boot up before we go in there.
Wow.
And glove up. So gloves, gowns, and booties we always need.
So PPE.
Yes,
just like we needed through COVID in the beginning of COVID. Didn't realize that either. And so I think if people are in Lake City, for sure, or even in the Gainesville area, they can take a trip out and have a great time either seeing dogs, cats, puppies. I don't know what other animals you have there. I feel like I've seen a lion.
We have. We've had a baby lioness.
Oh my goodness.
Come to visit us. We've had a leopard come to visit us.
That's
crazy. We've had a possum. We've had a bobcat, a baby bobcat.
Oh, wow.
Our clinic does partner with other facilities, animal facilities, and Mystic Jungle is one of our partners that comes in and sees us. And so we have the opportunity to see animals that we wouldn't normally get to see.
Yes. And you've held them. I see that.
Yes, I have held them. I have cuddled them. They are so sweet. Yes.
And probably everybody in the public isn't going to get to do that. But our seniors can definitely come and see puppies hands-on. The Pup Cup thing is great. Pup Cup Tuesday is a great idea. And if you're outside of this area, they could potentially find other humane societies, right? I don't think that's just a Florida thing.
No.
Humane societies, shelters,
everywhere.
They're everywhere because unfortunately, sometimes there are stray animals and they need to be taken care of and they need to find a home.
Right. And we are the only one in Columbia County and Lake City. We are the only humane society. And so we get a lot. We have funding from the county and we also have funding from the city. But what goes along with that is that every animal that the county brings in comes to us. And so we have 61 kennels, and so they get full very, very, very quickly.
Wow. So just another thing that maybe you don't even know, I work with community hospice, and we have some wonderful pet programs.
Yes.
One of the pet programs that we have for our patients is pet therapy, because we do realize just the healing and the comfort that pets bring. But another one that we have, another service that we have, is if there is a pet of someone in our services who is passing, we will foster the pet, and then we find a loving home.
That's
and we're
wonderful.
very careful
Yes, I
and
did
very,
know that. That's
very
fabulous.
picky about where those animals go. Now, I'll tell you, most of the time, I think we have about 1,400 employees. It's an employee or someone in the medical field that's a friend of an employee that gets those, but they get the opportunity
fabulous.
to have another great family life.
Absolutely.
And I just think it's a beautiful thing. A beautiful, beautiful thing. Well, Elizabeth, do you have anything else you just really want to share?
Oh, I could
before
be
we
here all day long,
leave?
Julie, sharing so many stories with you. But I know we have a limited time. So I do thank you for the time that we've had today and for allowing me to come in and
Yes.
share some things about the shelter and what it is that we do there. So I do appreciate that.
Yeah. And I am going to include in my notes your Facebook page.
Mm-hmm.
And I will also try to get a link for your Amazon account, because you do
Yes.
have a running list on
We do.
Amazon of
We
things
do.
that you desperately need.
And we have a new website. And so you can even go
Okay,
in there
yep.
and make donations on that website.
Perfect.
So that's also a wonderful added feature that we have as well. So
Wonderful. Well, I hope this has helped you today as you help your loved ones to navigate through the senior years. Pets are wonderful. They're a gift to us all, and we have an obligation to take care of them and our loved ones. So hopefully we've given some good ideas for this today. Thank you so much for coming, Elizabeth. And I hope that you will take a second, if you haven't already, liked, subscribed, and now share this podcast, because sharing is the only way that other people will find out about it. So please do so, and I can't wait to see you next time.
thank you, Julie, so much. I appreciate your time.
Thank
It's been great.